Well, we're excited because today we're going to talk about oral health, which is so important. And I think it's often so overlooked in the health and wellness space as a really vital part of overall health and well being. So, we wanted to open up and just ask you, why is oral health actually important for our overall health and well being?
So I love now, I think we're more focusing on the oral systemic connection.
Hmm.
So for so many years, the mouth has just been very separate from the health of the body. And somebody might have an infection right by their brain. And it's like, well, that's not a medical problem. It
Right.
absolutely is a medical problem,
Hmm.
but people don't have insurance and they don't have the funds so many times to treat their dental conditions. But the mouth affects the whole body, whether it's bacteria from the mouth going into the bloodstream. Some people have to take antibiotics before dental procedures and dental cleanings because some of the bacteria in the mouth is so toxic that it can travel down and cause an infection in an artificial joint or in your heart and things like that. Or just the inflammation in general causes that immune response in your body. So it's very much a medical whole body issue. And for so many years, the mouth has been very much separated from general health, but it's really so integral to your whole health.
I learned recently too, I can't remember the bacteria because I had never heard of it, but sometimes it could be in the mouth. And if you have periodontal disease, like periodontitis, is that the right? Like just
Yes, periodontal
inflamed
disease or yes.
inflamed gums and they bleed when you floss or brush or something, that there's actually that bacteria has been found in the brain at higher levels with people with dementia.
Right, so that's been the
Fascinating.
newest thing. So so some of this bacteria gets under your gums and it forms a biofilm. We've known about the link between periodontitis and cardiovascular disease, stroke. It causes an inflammatory response that causes plaques to form in the blood vessel, thickening of arteries. But now, like you're saying, they found oral bacteria in the brains of patients with Alzheimer's.
That's so crazy.
They found oral bacteria in like placenta.
Oh gosh, that's scary.
Yeah. So, if your gums are bleeding, that is a sign of inflammation. So that's definitely something that needs to be
Hmm.
addressed. I really want to talk about changes in dentistry. I mean, things have really changed. Like we look at the microbiome, we look at airway. We even have like myofunctional therapy to expand kids' airway and stuff like that. Airway is huge now. So we're seeing that adults have sleep apnea because there's not room to put your tongue in the roof of your mouth at night, but drops back. A lot of
Mhm.
old orthodontics, they used to take out 4 teeth, bring everything in. I mean, so I sucked my thumb when I was little, so it narrowed my
Mhm.
arch. Then they took 4 teeth out. Then I had sleep apnea. So I did ortho to expand my palate, and I do not have sleep apnea anymore.
Wow.
It's like pretty amazing.
Yeah. And you were talking earlier about the palate expanders that are sometimes working for kids to avoid crowding the mouth, and then the tongue drops back, and then they have sleep
Yeah.
apnea, like you were saying.
So, right, that's a big issue. So now we're looking at kids' airway, and if they need it, we're expanding the palate so they have room for their tongue to rest at night. You want your tongue to rest in your palate. Well, a lot of people don't have room, so your tongue drops back. You snore or you have sleep apnea, and those are issues that can be helped with orthodontics or now myofunctional therapy. So,
Oh. I have been waking up drooling, and I'm like, "I think that means my mouth is open, right?" If I'm,
probably
like,
so, yeah,
I think it's from my allergies.
yeah.
Okay, so I am a mouth
Yeah.
breather because I drool actually every night. Also, I think that's important just to clarify. Your tongue, yeah, should not be resting on the bottom of your mouth. It should be up at the top of your palate, which is the roof of your mouth. Same thing when you swallow. You shouldn't be swallowing with your tongue like pushing on your bottom teeth or kind of on the bottom of your palate. A lot of people do that apparently. It's a reverse swallow. It's kind of like a tongue thrust. It's not efficient and it's not good for your oral structure or just efficiency in general. So, Even like if you notice on your kids or babies, you can kind of pull down and see where their tongue is when they're asleep. And if it's not at the top, you can even just kind of provide some support under your chin or like the sublingual space and just push it up.
You're listening to One Body, where we talk about health and science. I'm Cruzy. I'm a physician associate.
I'm Eden. I'm a speech language pathologist.
You only get one body, so take care of it.
We're trying to have a good time, but we're not trying to waste your time.
Okay, let's get into it.
Okay, guys, welcome back to the podcast. We are joined with a friend and expert, Dr. Leigh Kuyrkendall, Dr. K. She is one of my good friend Caroline's mom. She is a dentist in the Chattanooga area, graduated from the University of Mississippi School of Dentistry. Actually spent a summer in Peru as a missionary dentist, has 3 lovely daughters, and is now the president of the nonprofit Revive Dental Board of Directors here in Chattanooga. So before we get into all of the good stuff, tell us more about what you're doing in Chattanooga with Revive Dental.
So what we try to do at Revive is it's a very low cost, probably a third of the cost of a normal dental office, but we're able to do very advanced comprehensive care. So while we're doing the work, we're training dentists for a year after dental school in advanced surgical procedures and comprehensive full mouth dentistry. So
Mm.
it's a wonderful system that provides dental care to a lot of people that are employed. They're working, but they don't have the funds for dental care.
That's amazing work. Tell us a little bit more about what you were doing in Peru. What did that look like?
So we were in Trujillo, Peru, and we started the construction on it's a church that has a medical and dental clinic and a school. So we were there for a year to start that building process. And we worked in like the poorest area of Trujillo. And we first set up a dental clinic in the church there and then have moved it to the other location. But it's still going today, and it's run by Peruvian dentists and Peruvian doctors. I mean, it's a beautiful thing to see. We
Aw.
went back to visit a couple summers ago, my youngest and I.
It was always Caroline's flex though. She's like, "Yeah, I live in Peru. I'm from Peru."
Okay, I have to ask you a little side note because I went to a new dentist and they did something new the other day. They like tapped my teeth with a sharp, what's that thing called? The little sharp hook thing?
Explorer.
Okay. They like tapped it, but not tapped it, kind of like stabbed my gums. And they would be like, 1, 2, 4, 4, 2, 1, 1, 2, looking. What are they doing?
So that's a periodontal probe. So
Okay.
what happens with periodontal disease is if you have plaque on your teeth or under your gums, the minerals in your saliva make it harden. So you might have this tartar under your gums. Well, then your
Mm,
body has the inflammatory response. It sends these cells to attack this irritant in your mouth. It breaks down the bone around the teeth and creates inflamed gums. So what they're doing is measuring pockets.
Hmm.
So
okay.
they're saying, oh, you've lost 2 or 3 millimeters of bone if you have these periodontal pockets. So they're checking for the health of your gums there. So
Hmm.
if you have these deeper pockets, like some people might have a 7 millimeter, like you're probing around and all of a sudden there's this deep pocket. Well, that is just a pocket of infection and there's a biofilm down there. And that's where that really toxic bacteria
Hmm.
collects and can get into your body and affect your whole body. So the 1 to 3, we're hoping that you want to have like 1 to 3 millimeters of is healthy level and no bleeding as we're probing, but they're measuring for any periodontal pockets there.
Okay. That makes sense. Y- You wrote here that over 40% of adults over 30 have periodontal disease. That's a lot.
Yeah, that is a lot. We have traditionally heard 30% of the population has periodontal disease. So gingivitis is the first stage when your gums are inflamed and bleeding, and that's reversible. But once you lose bone, that's not reversible anymore. Then we want to maintain and stop the bone loss. And we want to lower the bacterial count in your body. So some people have to go every 3, every 4 months if they have periodontal disease.
Okay. And there's a laser treatment for it?
So when people have pockets, we even use the laser in the pockets to get rid of some of the bacteria. Lowering the bacterial load is what we're trying to do with rinses, with ultrasonic cleaning, laser. There are different methods to treat, but it's hard to get down into those pockets. Like when you're brushing and flossing, you're not getting
Mm,
into these deeper pockets. And
okay.
that is why I recommend I love water picks. I feel like that gets under the gums better sometimes and it breaks up the biofilm and you can do salt water
Mm.
in it or some essential oils or things like that or rinses and you shoot it under your gums. I recommend there's one you can take in the shower. It's a portable one. So just use it in the shower. Some people are not going to floss and we realize that. So we're like, okay, well, there are these little proxy brushes that you can put between your teeth or use this water pick in the shower. Obviously, brushing and flossing. And then I love water pick. I love oil pulling, but we know that some people are not going to do that. So we try to find things that they will use and will be able to do.
I have found it's like habit stacking. Our sister Beata actually told us this trick because she will only floss in the shower because she's like, flossing is so boring. But if I'm doing it in the shower, I can like take a longer shower and, have the hot
Enjoy
water
it.
on me and enjoy it and floss.
Yeah.
So I might do the water pick in the
Yeah.
shower trick. That's
That's
smart.
an easy thing to do.
Yeah.
Okay, it sounds like we know a lot, or you know a lot about the mouth and why this is important. Why do you feel like dental cavities are still the most prevalent, like chronic disease?
I think it's our diet. I mean, I've gone to other countries and they don't have as many cavities. They might have periodontal disease. They might have not seen a dentist,
Mm.
but our diet, there's so many carbs, so much sugar, processed foods. Some people will just sip on sodas all day long. Even, I mean, juice has sugar, milk has sugar. If you're just sipping on something like that all day long, you're bathing your teeth in acid and sugar all day long. You can have a soda at lunch and drink it right then rinse your mouth out with water. But if you are people work in restaurants and they sip on Cokes or whatever all day long. So that's the worst thing you can do. Then also a lot of, especially older adults now, what a huge problem we have is they start taking a medicine that causes their mouth to be dry. And your saliva really is so important to help prevent cavities. So they might come one visit 6 months later and have 10 new cavities. So that dry mouth is really an issue that if that changes, if your mouth all of a sudden becomes really dry, you've got to be very proactive to prevent cavities. But mainly our diet, a lot of sugar, a lot of
Yeah.
carbs.
Okay. And I know I've heard you're supposed to give your mouth like 1 to 2 hours to let the pH restore and all of that. And I think I do that, but I wasn't thinking about liquids. Like I'm always sort of sipping on something. I was curious about electrolytes because to me, that's kind of equal to water. Like it's healthy, it's good for me, but
Okay.
I do think they have sugar.
If it has sugar, it's not, you don't want to sip on it. You know, it's okay to drink it and then rinse your mouth out with
Okay.
water.
And is it because the sugar is
Hmm.
feeding the acid and the acid is breaking down or demineralizing the teeth, or what's actually happening there?
So sugar forms plaque and the biofilm on the teeth. Well, the bacteria and certain bacteria eat the sugar
Mhm.
and give off acid as a byproduct.
Okay.
So that acid forms cavities or holes. Cavity means a hole in your teeth. And the first thing we see are these white chalky spots. So that's where you've lost minerals. Your teeth are always losing minerals, demineralizing and remineralizing. So acid demineralizes, takes minerals out of your enamel. So if you see people with a lot of these white chalky spots, that is demineralized enamel. That's the stage before it turns into a cavity. So, like, say if kids with braces, they get their braces off and they've got white chalky spots all around it, that's demineralized enamel, and that is a stage before a cavity.
Wow, because that's so common, I feel like.
Yes, it is.
Huh. Oh, the other thing I was gonna say that a lot of people do, and I'm guilty of this, is drinking carbonated drinks all day because those have a lot of times they have some fruit or they're typically very acidic. So like you're saying, if you're drinking that all throughout the day, your saliva doesn't have time to actually remineralize the teeth.
So that creates a more acidic environment in your mouth. You can remineralize your teeth if you're, you know, fluoride, and we have new things to remineralize teeth now. So fluoride, a lot of people don't like because it can be toxic, but now we have hydroxyapatite to remineralize your teeth. But it is very expensive. There are certain brands we like. The FYGG and
Uh-huh.
Risewell are two products that we like. But I mean, a tube of toothpaste is like $12. It's very
Yeah.
expensive for a lot of people.
Yeah. Okay.
Fluoride, like, I have a love-hate relationship with fluoride. Like, I realize it can have harmful effects on parts of your body, but it really helps prevent decay in your mouth. And when people stop doing it, I see, they might have a lot of decay, that's a problem and it's expensive. I do think remineralization is important, whether you use fluoride or hydroxyapatite. It's very important.
Have you found the hydroxyapatite or what's the difference in nano hydroxyapatite and hydrox?
Nano is just smaller particles, and they think it's easier to get into the enamel.
Okay.
And there's been some research, and it's a newer product. So they're still having research, and some people like the nano, some people like hydroxyapatite, but I think there's still a lot more research to come.
Have you found, I know it probably still needs to be researched, but have you found it to be equivalent to fluoride for
Yes.
the remineralizing?
Even those chalky spots I was talking about, we've seen them be remineralized with the hydroxyapatite. So we really like it. The cost is probably the most
Yeah.
difficult thing.
Okay, you said a cavity is a hole. That's good for me to know. Did not know that. For anyone else that doesn't know this stuff, I guess I like look for spots on my teeth, like the but looking for
Yes.
those cloudy spots maybe first.
So some people just have a lot of stain. So we look at both the x-ray, and if you have stain, that's what we check with that Explorer. And like, is it soft? Does my Explorer stick into it? A cavity is going to be soft typically, or we can see it on the x-ray. Sometimes the tooth is dark and there's a cavity underneath, but it's not sticky. So we're looking at all of those things when we check your teeth. Sometimes those stain, it can just be stain, and some people have a lot of stain.
Okay. And a hole in your tooth is bad.
So it's breaking down the enamel, and then it gets into the dentin, the next layer, and then that's getting closer and closer to the nerve. So once decay gets into the nerve,
Mm.
the tooth gets infected. So you either have to take the tooth out or you have to do a root canal and crown usually. So if you catch cavities when they're small, you can do a filling. And that's a $200 or $300 issue, when a root canal and a crown is like a $2,000 or $3,000 issue. So catching things early is really important. And
Mhm.
even we see on the x-rays, we're looking for cavities between your teeth, which you can't see in the mouth.
Right. Okay. I just went to your clinic and got a pulp cap.
Yes. So we're trying to put something over the nerve so the nerve will shrink away from the damaged area. And it's a healing, like a medicament to soothe the nerve. That's trying to prevent you from having a root
Mhm.
canal.
I was thankful for that, and it was interesting. She said even your X-rays or like looking at your teeth, it was deceiving. Like your teeth looked actually better than they were. And then when she started to get under it, she realized how serious the issue was, which was a good reason for me to go to the dentist. And a lot of the stuff like the looking in between your teeth, you just can't see. Like you can do all of the water picking and everything yourself, but we need like this medicine, this technology.
So, like, sometimes there's not even a sticky spot, but just underneath, there's a micro cracks that bacteria is leaking in and creating this problem underneath the enamel.
Yeah. So I get a lot of cavities. I feel like I have good oral care. Are there any like vitamin or mineral deficiencies associated with cavities that could be contributing?
Genetics plays a big role. Now we're finding out your oral microbiome is important also, the amount of saliva, if you use more acidic things, as acid and sugar. But some people do everything and they just are very cavity prone. And maybe it's the quality of enamel. So I would just say do the normal things. If you really were having issues with cavities, we can look at, you can take oral probiotics just for the oral microbiome.
Mhm.
And then when we have things for people with dry mouth, we have recommendations for them. But just brushing, flossing, water pick, and I do like oil pulling. But even you can do all those things and still be kind of cavity prone.
Is vitamin D
Mhm.
or calcium deficiency, is that ever something that you would want to look into in a patient? If you saw other signs that were concerning for a deficiency there and they kept
Maybe
getting better?
so.
Yeah.
That might a vitamin deficiency could be
Mhm.
part of the issue.
Yeah.
But you definitely need calcium, remineralizes your teeth, and vitamin D is good for bones and teeth. So
Okay. Interesting. This is kind of it's a funny question to ask a dentist, but people always say it depends on the dentist you go to how many cavities they will find. And some dentists maybe are much more sensitive to like what they would call a cavity. And then of course there's the dark side that people think some dentists just try to make money. Like, what do you have to say about that?
right. So 5 different dentists may give you 5 different opinions on things. I like to do smaller fillings because I'm like, I'd rather do a little filling that's not anywhere near your nerve, that's not going to be sensitive afterwards. Then some dentists are going to wait and watch. I try to be conservative, but also I want to avoid future problems. Some people have cracks in all of their teeth. So some dentists might say, well, you need to crown every tooth. But I try to be more conservative in that way of, well, we'll crack if you have pain when you're chewing nuts or something, you definitely need a crown because you don't want to split the tooth.
Oh,
So there are different opinions. Hopefully, people are being moral, and you do
yeah.
have to really trust your dentist, though. So I'd
Mhm.
recommend getting recommendations from other people because it's super important that the work is done well and that it's the correct work you actually need to have done.
Yeah.
But still saying that, 2 or 3 dentists are all gonna have kind of you'd probably get 3 different treatment plans, and it's because this is what we're seeing, this is our level of being conservative or more and our experience. I used to wait and not crown teeth with cracks until people were really having sensitivity, and then I saw, well, every time now they have to have a root canal also.
Yeah.
So now I'm more proactive about if you have any sensation when you're chewing hard things, let me know because we want to go ahead and crown it right away. We don't want to wait. So I guess experience also.
Walk us through an ideal day of oral dental health as far as like brushing, flossing, eating habits, drinking habits, like any other thing, like you were talking about oil pulling. I want to hear more about that. Just walk
Okay.
us through if you had the perfect patient, what they would be doing.
So definitely brush and floss, and I would say in the morning. After lunch, if you can brush, that's great. And I like you need a soft toothbrush. That's very important. A hard toothbrush can push the gums down or cause damage to the enamel. If you can't brush after lunch, rinse your mouth out with water. If you have a soda, rinse your mouth out with water to help restore that to a good pH level in your mouth. Nighttime, I would say brush and either, like I said, do the water pick in the shower maybe. And before bed, I would say do the oil pulling. It's hard to keep doing that because you need to rinse for like 1 to 3 minutes. And then they say don't spit it down the drain because it can clog your drain.
Oh.
But it is a great
Mhm.
thing to do. It's just kind of a hard habit to continue, I would say.
What exactly is oil pulling? What is it
So
doing?
it's a coconut oil, it's a neutral oil, and then there's certain essential oils
Mm.
that are helpful antimicrobial, like
Okay.
clove oil. I think it's got cinnamon in it, and you mentioned oregano oil. So it's got some essential oils in there, but you're supposed to rinse for 1 to 3 minutes. But if you have dry mouth or super cavity prone, I would recommend doing that at night. And I think it keeps bacteria from forming those biofilms because it's a slick surface. And I think it would just help keep your tissues more moist at night.
Hmm, fascinating. And you talked about the importance of your saliva and problems with dry mouth. So if someone's having that, that'd be an important thing to talk to the dentist about because the saliva, like you said, is so helpful. The saliva, I think, has antibacterial properties too, right?
Yes, it remineralizes your teeth. It washes away food off the teeth. So a couple of things we do recommend: Theramints, Theramint with that just help keep the mouth less dry. Biotene, there's oral rinse and toothpaste that you can use to help keep your mouth from being dry. And then I do like oil pulling for patients with dry mouth. So sometimes what happens is they'll put a peppermint or a cough drop in their mouth all the time that has sugar in it.
Yeah.
So that is
Mhm.
like doubling the problem. So
Hmm.
then just counseling them on things that they can do. I say keep water by your bed at night. They definitely have to be much more careful about their dental care.
Yeah. I've heard with kids a lot of times and adults, but kids are more snacky typically with like crunchy, yeah, cracker, like goldfish that just they just get stuck all in the teeth. And kids are also not really able to brush adequately or floss. So, and some adults too, like if you're just kind of snacking all day and then you're not rinsing your mouth or giving your mouth, your saliva time to kind of brush the food away, then that's just going to sit there and start breaking down the tooth
Yes,
too.
that's exactly right.
How long does it take for your saliva to re-mineralize your teeth after eating and drinking?
It's 30 minutes to 2 hours, so it takes a
Okay.
while. So definitely rinsing will help speed that process up.
Okay. And then the actual importance of brushing and flossing, what are those actually doing and why do you recommend both?
So, like I said, I like a soft toothbrush or an ultrasonic toothbrush, like Sonicare, Oral B. We can tell a big difference when people start using those, but cleans the plaque off the teeth. But the ultrasonic also is massaging the gums, like stimulating blood flow,
Hmm.
keeping your gums healthier. We can tell a big difference when people start using those.
Are those electric? Is that what you mean?
Yes.
Okay.
So you can get them at Costco or Walmart or online or anywhere. Sonicare is probably our favorite. We also like Oral B.
Mhm.
So flossing then is getting underneath the gums and removing that biofilm and plaque from underneath the gums, as does the water pick or proxy brushes that go between your teeth. So that's removing things under the gums. And that's
Nice.
where you get into periodontal disease when you get that tartar under the gums and you can't brush that off once tartar's on there. And I think some people that probably take a lot of vitamins, they have, or certain people have more minerals in their saliva. So some people form tartar super quickly. So, and that, it, like I said, is an irritant that starts, then your body starts fighting that.
Brush for 2 minutes, is that still the childhood rhyme?
Yeah. Some Sonicares even have timers on it, and they
Yes.
tell you to move to
Yes.
the right.
That's what mine does. I'm like, "Oh, I have to move," instead of, like, singing my ABCs or whatever. But the other thing that my dental hygienist always reminds me of is when I floss to do, like, the Y shape instead of just going up and down, so really getting under the gum on both.
Right, and you're think of it as like rubbing this tooth here, and then you bring it over and you're rubbing both teeth. You're rubbing the plaque off the teeth. If you just go up and down, you're going up into a space. So you wanna rub the floss against each tooth.
Yes.
Do you have any opinion or recommendation for the order in which you're doing like flossing, mouthwash, brushing, morning or night?
Mouth washing last. I say flossing first and then brushing, but I think if you're doing all 3 of those, we're not gonna complain about the order.
And any more opinions on mouthwash specifically? I know I've been recommended to get an alcohol free.
Alcohol definitely dries your mouth and disrupts the oral microbiome, so we don't like you to use mouthwash with alcohol in anymore. There was another rinse that we used to recommend for gum disease, chlorhexidine. Now we're not recommending that. I like Closis,
Mm.
CLOSYS is a good rinse. And then also, if you wanted something with peroxide in it, there's a peroxyl rinse. Warm saltwater rinse is we use for after like extractions or surgeries. We tell people to do warm saltwater rinse to help heal. Those rinses that decrease the bacterial load but don't have alcohol is what we recommend now.
Okay. And what about baking soda? Do you ever have people rinse with baking soda?
Yes, some people brush with baking soda, which is it neutralizes the mouth. It works well. We don't like people to use abrasive things. Like the charcoal can be very abrasive and it can over time it's wearing enamel away.
Okay.
So I don't like abrasive things.
You talked about the toothbrushes. My only this is me getting like I'm trying not to become a crazy person, but I am becoming very aware of microplastics. All the Oral-B products, I think, are plastic bristles,
Probably.
and I don't know if you have an opinion on, like, the bamboo ones or any of the more, like, plant-based brushes.
That's a great question.
Yeah.
As long as they're soft, I think they should be okay.
Yeah, I mean, it's kind of a newer thing too, but I have heard that you end up ingesting a good amount of the little plastics. And you know what's crazy is the I'm sure it's still out there, the little kid toothpaste that they're just swallowing. When they used to be, like, bright red, so probably tons of dyes in it, and then they would have the little flakes, like fairy dust in
Yeah,
the toothpaste to make it look cute. Those just little pieces of plastic.
I know.
It's so
And it's getting
crazy.
in our bloodstream. I know.
Yes.
Yeah,
Yeah, wild. I'm like, "Oh, man." It's like you kinda wanna know these things, and then you kind of don't, not 'cause then
I
you
know.
feel
Because
crazy.
you really do. You can kind of drive yourself crazy.
Yeah.
So you have to have a balance.
Yes, 100%. And then you talked about 2 of the hydroxyapatite toothpaste that you like was Fig or FYGG,
Yes. So
and
it also restores the healthy microbiome and has a hydroxyapatite remineralized tea. And that
okay.
dries well. Those are just the 2 I'm more familiar with. I'm sure there are other good products.
I think there's a lot of hydroxyapatite products now, but those 2 specifically have a higher percentage of the hydroxyapatite, so it's actually gonna be effective. What do you worry about when someone has chronic bad breath?
So there are different reasons for bad breath. Some of it is just bacteria in the mouth. Like if people have periodontal disease, that's a definite odor and it's a pretty distinct odor. A lot of bacteria in the mouth, maybe on the tongue. Tongue scraping helps with that. The rinses like closis also help with bacteria in the mouth. It also can be sinus drainage though, like chronic sinus drainage. Dry mouth can contribute to bad breath also.
Mhm.
Diabetes, those are the things you might think about, like worst case scenario.
Yeah. Eden, how about your tonsil stones? I know
Hmm.
that's been an issue.
Yeah.
Yeah. It's like my worst thing in life, honestly, is my tonsil stones. I can't get rid of them. Like, they're ruining my life. I wanna get my tonsils taken out, but I don't wanna get a tonsillectomy at the same time. I actually just did an oral microbiome, like, saliva test. Bristol is the company I use. I don't know if you're familiar with that. So I'm waiting for my results. They're they're looking I think they're trying to differentiate, like, gut versus oral. I know it's all connected, but trying to make sure there's not something more than that. I do have postnasal drip pretty commonly, so I think it's just all connected, and then I have, like, velopharyngeal reflux as well. It's just, like, all the bad things are, like, coming together, and it's really frustrating.
So I had sleep apnea. I was doing a lot of mouth breathing at night. I think that contributed to my tonsil stones plus postnasal drip.
Hmm. Yeah, I've seen a lot of, noise on social media about tonsil stones. The algorithm is really curated to me specifically right now, and there's a lot of topical, like, oral, I don't even know what you would call them, almost like a paste. I'm really, like, skeptical of buying any of those products. Your clinic also did recommend an oral probiotic, so I tried that, but I didn't have, like, the full dosage, so I don't know if it did anything.
So also I use like a saline nasal rinse and then neti pot. I like that too. I think
Okay.
rinsing your sinuses out is also really important.
Mhm. We just talked about that in our last podcast, and I was influenced to buy the, like I got Ayer, AYR, I think it's like the off-brand version of what that ENTPA had recommended, but it helped me sleep. Like I had a sore throat and postnasal drip. I did it right before bed in a hot shower as well, and it like I actually slept much better.
Speaking of the mouth body connection, do you have infections in your upper teeth? I had a patient that we did a CBCT on, and their sinus was full of infection. So they had a tooth that was infected, and then their sinus was just full of infection. So there's a connection that, like, dental infection can go up into your sinus. So not only did we have to take out the tooth, but then she had to go in and have sinus surgery to clean that out. So
Wow.
it's pretty amazing. Like, it does affect your whole body.
Another reason to go to the dentist 2 times a year at least. Yeah. We kinda talked about bleeding gums, pink in the sink.
It just indicates inflammation. Sometimes there are things called open contacts, like the way your teeth contact is really important. If they're not touching and like floss doesn't pop, then food is just packing down in there. So that can be a traumatic cause of a gum pocket or things like that. And your gums are going to bleed when that happens. So
Hmm, hmm,
you want the floss to pop through your teeth.
okay.
What are safe ways to
Hmm.
get white teeth? Because we all want our teeth to be white, but we're trying to avoid like super toxic products or things that are going to be damaging the teeth.
Yes. So whitening is most whitening products are peroxide based. So things you buy over the counter have a lower percentage of peroxide. In office treatment has a higher percentage. And the main problem with whitening, you don't want to over whiten, you don't want to demineralize your teeth too much or cause sensitivity. But the lower levels of peroxide are not very harmful to your teeth.
Okay.
You just don't want to do it all the time, but whitening occasionally is fine.
What about baking soda? Have you noticed that that helps with whitening?
I think it does help, and some people brush just with baking soda. My hygienist, they do a lot of research. They like brushing with baking soda. You're not getting any remineralization, though, is the only thing.
I do it after, like I brush my teeth with a toothpaste that does not have whitening properties, and then I do a little baking soda. You said charcoal's too abrasive.
I think it is to use every day.
And then whitening strips, any brands
Mhm.
that you like?
I read reviews about Crest white strips seem to be
Effective.
they're economic, yeah, they're universal, so I think those would be fine.
I've used Lumino.
That's coconut, and I think helps whitening. Okay, well, I think that was so helpful. I wanted to conclude and do like a little rapid fire in and out of some of the hot topics in oral care and the dentist world. We've touched on a lot of these, but just to kind of wrap up and summarize, I want you to just say in or out. If it's in, you like it, you see the benefit. If it's out, it's kind of hoopla and we should waste our money. Okay. So you talked about oil pulling.
Yeah,
In, okay. And that is a coconut-based product.
usually coconut oil. I've read olive oil also, but usually
Okay.
coconut oil is what would be my preference.
Swish it around your mouth. You said 2 minutes?
1 to 3 minutes, and
1 to
then
2.
spit it in the trash.
Put it in the trash. Lovely.
Yeah.
It's a cute habit. Okay, tongue scraping.
Yeah.
In,
A lot of halitosis comes from the tongue, so reduces the bacterial count in the mouth.
okay. Every night, is it good to do it every day?
I'd say every day.
Mouthwash we talked about, but just give us your 2 cents.
So no alcohol. I like Closis and Peroxyl. Those would be my preferences.
Water pick.
Love water pick.
In,
Yeah.
especially in the shower. It's like a spa.
Yes.
Mouth tape.
In if you can tolerate it and sleep.
Okay. Saltwater rinse.
And I would say more for if your mouth is healing from something.
Okay. And then you talked about other just like plain water rinses after eating or drinking something
Yes.
with
Yeah.
sugar or acid. Oregano oil.
I like there's certain essential oils in the oil pulling. I like them blended with the oil.
And oregano oil is antimicrobial.
Right. So we have clove oil, cinnamon, tea tree, or antimicrobial.
Okay. And then we talked about baking soda rinse, like making a little slurry.
in or brushing with baking soda.
Good, okay. The last one I'm curious about is xylitol, especially like gum or any xylitol products. What do you think of this?
So that does help prevent cavities. It's a sugar substitute and it actually helps prevent cavities.
That's so confusing to me. Like, it seems so weird that chewing on, like, a sugar substitute would actually help your teeth. It's so weird. What about nicotine patches? Do you have any?
Then a lot of people do that. So when you have a cleaning, we check for oral cancer. If we see a lot of times it might create a white patch or so sometimes we even send people for biopsy. That's not great for your mouth.
Yeah.
If people are going to do it, we tell them at least move it around. Don't put it in the same spot.
Yeah, and now there's, like, you can put a patch on your skin, so I don't feel like you need to be putting it on
Yeah.
your gum, you know?
But definitely we watch those and sometimes we send people for biopsy because the first thing we see is it forms a white patch. Just that tissue is constantly irritated by that patch.
Yeah, makes sense.
A lot of my friends and coworkers avoid the dentist because of a genuine like anxiety and fear around going to the dentist. A lot of kids are afraid of the dentist, but I think it's becoming more of a thing in adults, maybe more something that we talk about or just things you see on social media. What's a piece of advice or something you would tell that person?
A lot of people are very fearful of the dentist. And sometimes it's because of a traumatic thing that happened as a child or bad experience. So I would say get recommendations and maybe seek out a dentist that really can help with anxiety. I mean, sometimes we have to use nitrous on patients for cleaning, or we have to prescribe an anti
Mhm.
anxiety. It's not ideal, but it's better than them not coming because what happens is they have anxiety. They don't go until they have an emergency. They have to go. They have another bad experience. And, it's like every time they go, they have a traumatic experience because they're not having these normal cleaning appointments and positive visits. So I would say really find someone who's understanding and will help. We use weighted blankets. You can have music going while you're having your dental work done. We try to make it very comfortable for people so they do have a positive experience.
I know for me, yeah, I avoid it because it's, like, embarrassing to have a cavity. Like, I don't want them to see my bad teeth or something, but if you do have a problem with your teeth, it's just gonna get worse, so
Okay, well, I thought that
yeah.
was so helpful. I feel like oral
Good.
health, there's so many trendy things, and it's just nice to have a dentist who's actually, like, worked in the space, working in the space, keen on functional medicine, like, just give
Yeah.
your opinion. So I'm so
Mainly, we
grateful.
want your whole body to be healthy. We don't want you to have inflammation. We don't want you to have this bacterial count that travels to other parts of your body. So,
And a pretty smile, you
and
know?
a pretty smile.
Yeah,
Yes.
and no bad
Dentistry
breath.
is really interesting. It's like art and engineering and science. It's a lot of things combined.
Yeah.
Like the things we do, they have to look good
Mhm.
and be very functional.
And it contributes to, like, confidence and, I mean, a smile, obviously bad breath. It's a big part of, like, your day and how you talk to people, how you present yourself, yeah. Well, we appreciate your expertise and your time.